All right, so this is a question I hear all the time, and that is, Joel, my knees are cracking. They sound horrible. Is this bad? A lot of times people say it doesn't really hurt all that much, but they're just making a ton of noise, especially going downstairs. And so I want to kind of just address this issue a little bit and tell you what, we tell people when they come to see us. So the surface of your bone, right, is kind of like this cup. I grabbed one of our coffee cups here. In that it's hard, but it's really smooth, right? And that's kind of the cartilage surface on the end of the bone. Kind of dug up a little anatomy picture here. Hopefully you can see it. And you can kind of see in this area here, see right there where it's really white, right? So there's your knee, here's the kneecap, and then these white parts, that's the cartilage part of your knee. And again, in this picture, it's really smooth. So as you use your body, right, the cartilage there will show some wear. And when it does, it gets a little rough. It's not as smooth as the surface of the cup anymore, okay? And that's normal, right? And so, kind of the analogy I like to give people is if you bought a set of tires for your car, brand new tires, nothing's more unexciting than that, and you drive it, and the tires will show some wear, but you're not like, oh, I'm gonna, these tires are bad now because they're showing a little bit of wear. It's gonna show some wear, okay? And the surface of your joints are like that too, in that if you use them and use them in a way that most people who are involved in some sort of sport or athletics, they will show some wear. And as that surface gets a little rough, that's what causes that noise, and that noise is called crepitus, okay? Yeah, it's a great word for it. It sounds exactly like what it sounds like. And people often say it sounds like Rice Krispies or sand in the joint. But the thing you need to know is having a little bit of that noise isn't really a bad thing. It just shows that your knee isn't brand new anymore, that it has a few miles on it. And the best thing for your knees is to actually keep using them. There's a lot of research that shows that actually how the compression of the joint ends, and that movement that you have, that's actually how the body brings nutrients to the joint, is through that compression. It's almost like a little pump. So blood flow and all the nutrients in that blood, that is how it actually gets to the joint and keeps the joint healthy. So the best way to actually continue to use the joint or to keep the joint healthy is to actually use it. So if you hear that noise, I would say don't worry about it, especially if it's not associated with any pain. Even if you have a little bit of pain with it, usually that will go away. And just know that it's a normal part of wear and tear on the knees, and you need to just keep staying active because that's actually the best thing for it. So, because a lot of times what happens is people will, because they have a little discomfort and that noise, will stop doing what they're doing, right? Like maybe not be as active, and then the joint will actually overall degrade because they're not as active, and you get less nutrients to the joint. And so you're actually going backwards. You may feel a little bit better short term, but long term, you're actually making the joint a little softer, and it's more likely to have problems once you start becoming active again. So don't worry about the noise. For the most part, is generally the thing we tell people. And keep being active, keep working through it, and you'll be fine. It's the best thing for your knees.